Two cases raise the total number of infections in the country to 1,618. All 147 new patients are Kenyans aged between 1 and 87 years old. 3 more patients have succumbed to the disease, raising the death toll to 58. Nairobi County has recorded the highest number of cases, with 90 people testing positive. Mombasa County has today recorded 41 new infections and Kiambu 3. Nyeri and Uasin Gishu counties have 2 cases each, while Kajiado, Kilifi, Embu, Homa Bay, Murang'a and Machakos all have a case each. In yet another alarming development, Nairobi's Kibera slum has recorded a daily high of 35 new infections, pointing to the risk brought about by overcrowding in informal settlements. Silas Apollo has more.
They have been the first line of defense, but one after the other, healthcare workers are also becoming victims of the virus, a sign of the immensely difficult working condition for medical staffers, who should be among those best protected against infection.
The number of healthcare workers who have tested positive for COVID, as at yesterday, that number stands at 54, which gives you a figure of 3.5%.
The new infections have been blamed on proximity of healthcare workers to patients and sometimes a lack of personal protective equipment.
Of course, the healthcare workers being the first line of defense, by nature of their work as they carry their mandate, then they are usually exposed to the infection. I'm glad to report to you that so far we have not lost any healthcare worker.
That our health workers are the most single important ingredient and factor in combating this disease. We cannot afford to have our health workers infected by the virus.
And it is not just the frontline workers who are concerned. In slums, the cases are also on the rise. Kibera had the highest number of new infections in 24 hours, recording 35 cases. The government is now concerned that the informal settlements could become the new virus epicenters. Concerns that stem from the reasoning that most of these informal settlements suffer from overcrowding and poor sanitation, which inhibit the practice of social distancing and proper hygiene. Of the over 600 positive cases recorded in Nairobi, a bulk have been from the informal settlements of Kibra, Dandora, Kawangware, Kayole and Mathare.
The figures which we have shared illustrate the rapid rate of transmission in the informal settlements of Nairobi. This means that there is a ranging number of infections in these areas. It means that this disease is now within the communities.
The ministry has also expressed concerns over what ripple effects a new spike of infections in these slums could pose to the larger population of Nairobi, as a significant percentage of the capital's population lives in the slums. This group also suffers the harshest effects of socio-economic inequalities, which experts say are the greatest accelerators of the virus.
Hakuna moja wetu ambayo yuko salama. Awe ni yule anauza mboga pale sokoni, ama ni tajiri wa aina gani, hakuna mtu ambaye sasa anaweza kusema ati hii virusi iko mbali sana na yeye.
Today, the ministry continued with the targeted mass testing, focusing on the expansive Lang'ata area, which also reported 15 new infections. But even with the successes of the testing, Kagwe warns that the targets may not be achieved.
The issue of testing, why the testing is low, it is essentially driven by the shortage of reagents that we use on the machines. And at the moment, those reagents are in great demand across the whole world.
For now, the government insists that focus will be on managing the community infections, which experts predict put more people at risk. Silas Apollo, NTV.